In a normal blood test, I found that I had an unusually high PSA. I can't tell you what those letters mean, but it's a test for prostate problems, and it was 8.67, which is rather high. My urologist felt it was important to do some biopsies to see if we could find out why. And very difficult cancer to find. I went through many biopsies and they finally nicked it. It's the only term I can find. And it was a rather small one, about the size of my fingernail, but very aggressive. At which time they sent me over here to the Cancer Center in Montgomery, and I met my physician, Dr. Franklin.
Colonel Fowler had been a fighter pilot and was a POW in Vietnam for multiple years. He went through a lot more during that process than he would have to go through his cancer.
Thanks much to some of the experiences I had previously, I wasn't going to sit there and just do nothing. You have to act aggressively. So I decided to give it a fight. So I went through 9 weeks, 5 days a week of radiation.
For radiation, we want to treat the cancer and we don't want to treat any normal tissue. So it's very important that the treatment be precisely aimed and precisely delivered. One of the things that makes the Montgomery Cancer Center unique in this area is we do something called image-guided radiation therapy, or IGRT. And what that involves is actually taking a picture of the cancer inside the patient before the treatment's delivered. The equipment is then able to make sub-millimeter adjustments so that we are very precise in what we treat. That's very important in prostate cancer because there are things there that don't like radiation that are very close. What I try to do is to put patients at ease and help them to realize that radiation only affects the part of the body that we give it to. It doesn't cause any side effects anyplace else. It's just the place that we treat. The technology has significantly decreased the side effects that you get.
I've heard nothing but the best things about this center, and I can personally attest thereto. And I guess what convinces me the most is when you go out in the lobby there, you'll see former cancer patients who have come back to be volunteers to help people and pass things out. If you think enough of a place to come back and volunteer after you've come through something catastrophic, I think on its face, as we say in law, a prima facie case, that says it all. Today I sit here with a PSA of 0.1, which once upon a time was 8.67. Dr. Franklin says I'm cured. You know, the man saved my life. What can I say?
I think the best thing that I do here is just treating patients. It's what I do every single day. It's meeting patients who have been diagnosed with cancer, helping them through a difficult time of their life.
I have 3 dogs, 3 cats, 2 horses, 1 wife. I think it does well for everyone to keep busy mentally and physically. You only have one life. You ought to use it and you ought to enjoy it.